Good evening. I'm Danielle Salomon from the Australian Friends of the Hebrew University. Thank you for joining us for the second webinar in our series, The Impact Exchange from Jerusalem to Australia, where we bring together leading scholars from the Hebrew University of Jerusalem alongside Australian experts for insightful conversations on some of the key issues shaping our world today. Following the tremendous response to our first webinar on trauma and resilience, we're delighted to continue the series with tonight's important topic, Profiles, Patterns, and Possibilities, Understanding Heterogeneity and Diversity in Autism. We're honored to be joined by Professor Cory Shulman, Director of the Autism Center at the Hebrew University of Jerusalem. Professor Shulman is a leading researcher and clinician whose work focuses on developmental trajectories in autism, heterogeneity across the spectrum, and gender differences in presentation. Her research and clinical leadership continue to shape more individualized and inclusive approaches to assessment, intervention, and support. Joining her this evening is Sydney-based specialist developmental and behavioural paediatrician, Professor Natalie Silove, who brings extensive clinical experience supporting autistic children and their families here in Australia. Professor Silove is head of the Child Development Unit at the Children's Hospital at Westmead and clinical associate professor at the University of Sydney. Together, they will explore how emerging research can inform real-world practice and decision-making for families, educators, clinicians, and communities. This conversation comes at a time of growing awareness around the importance of recognizing autism as a highly diverse spectrum, where individual differences in communication, social engagement, and development require thoughtful and responsive approaches to support and inclusion. Tonight's webinar is presented in partnership with Friendship Circle Sydney and Friendship Circle Melbourne, organizations doing extraordinary work to foster inclusion, connection, and community engagement for children and young adults with disability and their families. We received many thoughtful questions from audience members during the registration process, and these were shared with our speakers ahead of tonight's discussion. Rather than holding a formal Q&A, our speakers will weave many of these questions into the course of their conversation. We also invite you to submit questions via the chat during the webinar, and time permitting, our speakers will address some additional questions at the end of the session. Before I hand over to Professor Shulman and Professor Silove, we will show you a short video about the Autism Center at the Hebrew University of Jerusalem to give you some insight into the remarkable and life-changing work being done there. Thank you.
The Autism Center at Hebrew University is particularly effective because we work on several levels. We combine state-of-the-art research with clinical services, collaboration with the community, and training.
Autism is a multifaceted neurodevelopmental disorder. So if we're looking at the development of autism or understanding the mechanism of autism through one lens, we're just missing a lot of the picture. We need to work in an interdisciplinary fashion, fostering stimulation and conversation across fields. It's an amazing thing to look around the room and see experts in the area of genetics and neurobiology, education and social work, epidemiology and public health. Interacting with people from different disciplines and different faculties forces us to think outside the box. What's amazing and exciting is taking the knowledge that we gain from that cross-disciplinary stimulation and transferring it back to the community. That's why we work in close contact with NGOs, with government ministries, with the autistic community, with families of individuals with autism that tell us what are the questions we should be asking.
I think the center has brought an amazing dialogue between families, clinicians, researchers, people with autism. The center has given us a voice within this world of research and autism that's really given us a seat at the table.
We can see how what we're doing is advancing the field here in Jerusalem and beyond, and we're just getting started. We are training students so that they can be the leading clinicians and researchers in the science of autism.
As part of the Autism Center, I am exposed to so much more than my own research. Interacting with experts in different areas has caused me to think differently and more creatively about my own research.
We envision a richer, more informative research world in which collaboration allows us to respond to brain and behavior from the lab into the living room, trying to understand the complexity of autism.
The Autism Center is an essential aspect of what we do at the Hebrew University. It is essential for us to share this knowledge with the community around us to make our world a better place.
Together, the sum of which is much more than each of us individually, we can enrich the lives of people with autism and their family members.
Amazing work. And thank you. I'm going to hand over to Professor Silove now and keep putting your questions into the chat. Thanks.
Thank you so much, Danielle. This is such a privilege, and the best part of this for me has really been meeting Cory and having a like-minded professional across in Israel and at Hebrew University. I think it's particularly good that we are of different disciplines, reflecting the multidisciplinary approach, you being a psychologist background and myself from the medical background. And that was emphasized in your program, in your introduction as well, about the importance of the team and the multidisciplinary team. So I do want to acknowledge that up front, that it's a team effort. And we do want to acknowledge our speech therapists and OTs and social workers and psychologists, and of course the parents and children as well. Cory, I don't know if you wanted to add anything to your introduction, or shall we just
Yes,
start?
I would, if I can do that for a moment. I just want to, like you, thank you all for being here, and for Australian Friends of Hebrew University for inviting me to be here. And I want to take just a moment to share with you my history with autism. I do not have a family member with autism, but I did have a father who had a vision of how to raise his children with values. As we approached our Jewish coming of age, we had to commit to a project to show that we could handle the responsibility of becoming an adult. Don't ask me why, but I actually asked to volunteer with a 16-year-old autistic adolescent. I spent an hour weekly with Mikey, and I've never looked back. I've met so many autistic people and their families over the years, and they have enriched my life and also, I think, made me a better person. As you heard in the video from the Autism Center, we want to bridge research goals, clinical needs through collaboration with the community and training. So I just wanted to put that on the board because that will follow us through our discussion tonight. So thank you, Natalie, and back to you.
Yeah, no, I absolutely agree with you. Our lives are enriched by the work that we've done, and it's just that how we change autism now has changed so much since Kanner first described autistic disorder in 1947. And the DSM classifications and descriptions just continue to change over time. And we are now aware of that the broad spectrum and the significant heterogeneity. How do you make sense of these various profiles and patterns within this very broad spectrum? And also, why does it matter to do that?
Thanks. That's a really big question. And I'm not sure how we can really give it its due, but I'll do my best. As the definition of autism has broadened over the years, and we need to make sense of the heterogeneity in its expression, what we have to do is look for meaningful patterns and profiles. And one way to do that is through subgrouping. So we need to move from asking, diagnostically, does this person fit autism, to what does autism look like in this particular person in front of us? And in order to do that, we need to remember that autism is not linear. We're looking at something multi-dimensionally. Okay? It's not just high support needs to lower support needs. It's not just talking to non-talking, but rather we need to consider multiple dimensions: communication, social, behavior, sensory processing, emotional regulation, executive functioning, cognitive skills, and adaptive abilities. We have to look across those dimensions. We have to look within those dimensions, and we have to look for patterns of overlapping dimensions. So, one of my real interests in research, in bridging from the clinical world into research questions, was actually looking into both the diagnostic process over the lifespan and what instruments are best with whom, as well as looking into some subgrouping. So I'm going to give you a little bit of a taste for what that is. And I'll start with why diagnosis is so important. If we really want to understand individual patterns and profiles, strengths and challenges, then we need to get that information in a way that is both reliable and valid, with norms so we know who we're comparing to, and that can help inform our decisions for appropriate intervention. So just recently, we did some research in sensory subgrouping with a person with autism on our team, and she is a very, very, very amazingly bright human being who feels that she and her autism has been forgotten along some of the research patterns. And she said, look, we have to see if there's other people like me. So we took a very large data set and we did sensory subgrouping according to the sensory profile. And what we found was that one of the reasons her group has not been identified up till now is basically because people were not taking into consideration that that multidimensionality that I just spoke about. And they weren't considering different things. So what we did was, before we looked at the sensory patterns, we divided people into different cognitive ability groups. And what we found was that in the more cognitively able group, we found different sensory subgroupings than what we found in the less cognitively able group. And that's a really important thing, because what we need to be able to do is understand sensory processing in the individual in which it's happening. And an individual isn't just one dimension. What we found, surprisingly so, is that there was a group that for whom avoiding behavior is actually something adaptive. And we'd like to continue that research to understand the mechanism of how that works. I'll give you one more example of how this is important. And that basically is that over the last years, we've been looking at the difference of expression between males and females, boys and girls, women and men. And there have been some issues that have come up in the question of, are the instruments that we're using appropriate or not appropriate? And I very much felt that some of what our problems were in looking at the differences were methodological. So we took many years to develop a large data set with the same number of boys and the same number of girls who were matched on their cognitive abilities and on their chronological ages. And then we looked at them. And we just had an article published about the differences in the different instruments, which instruments pick up autism better. We had in that article looking at different outcomes for the boys and the girls. And what we'd like to do now is to follow that group and longitudinally look at the developmental trajectories. But what we found that was most interesting to us was that two of the issues that are not always taken into account are number one, the experience of the assessor or the evaluator, and number two, and perhaps more importantly, the fact that there are differences between boys and girls, not just in autism. And so we have an issue of there are biases of what we expect from boys and girls, and the instruments that we use were developed pretty much on male biased samples. So what we did find is that there were some differences. There are differences in imitation with girls doing better than boys. There's differences in communication and in empathy, and even in adaptive outcomes. But the instruments that we have are very good at picking it up in girls too, as long as we can train people to see what happens. So profiles and patterns are really important because they affect intervention. The same diagnosis does not necessarily mean the same support needs. For example, sensory profiles may lead us to environmental adaptations. Anxiety profiles can lead us to emotional and regulation supports. And executive functioning profiles can lead us to organizational and planning supports. I think this might be the time for me to put in a very brief discussion of pathological demand avoidance, or PDA. It's become something very real in the discussion of autism in the last couple of years. PDA is characterized by an intense, anxiety-driven need to resist everyday demands and expectations. But it's not out of defiance, but it is because the brain perceives these demands as pressure and as a threat to their autonomy. By the way, therefore, sometimes it's been reframed, particularly by the neurodivergent community, as pervasive drive for autonomy. PDA is not an accredited diagnosis, neither in the DSM-5 nor in the ICD-11, but it does describe a real behavioral profile. There are parents who describe children who experience ordinary demands as highly threatening and who become extremely dysregulated under pressure. Thus, I think it's really important to acknowledge this behavior pattern. And rather than arguing about labels, I often ask myself, what's driving this child's distress? In these situations, it may be helpful to avoid escalating demands, find ways to stay flexible, to stay regulated, and try to preserve the child's autonomy. In sum, profiles help us move from what is the person's diagnosis to who is this person and what do they need and how can we support them to achieve their potential.
Yeah, absolutely. I could keep listening to you, Cory, because I think that that really describes the situation very well. Currently, there's this tendency to refer to profound autism as a separate subgroup. And a recent Australian study highlighted the increased likelihood of absconding and challenging behaviours that place safety at risk in this group. I'm just wondering what guidance you might give to parents and therapists regarding managing these situations, and in particular, your view on restraints.
Thank you for that question, Natalie. I think you're being very, very humble in your thing because it's not just an Australian study, but you were very central to that study, which I read, not knowing that I would have the honor of meeting with you and having this amazing discussion with you. So may I thank you for that wonderful work that you're doing, and that I do believe that it's important for us to raise these issues and really think carefully, because one of the biggest shifts in autism has been moving from seeing behavior as a problem to actually seeing it as a communication system, something we need to understand. We need to understand what behavior means. We have to ask, why is this happening? Where is it happening? When is it happening? With whom it's happening? And then try to understand a little bit of what's going on in the child's world. Is it because of sensory overload, communication frustration, anxiety, avoidance, pain, discomfort, escape from overwhelming demands, as we just talked about, and or loss of predictability? I'll tell you a very quick story of an 8-year-old who was in a school with for a separate school for children with autism, um, who came in very, very dysregulated one morning. And nobody could figure out what was wrong with her. It was terrible. She's nonverbal, so we couldn't ask her. We didn't know. We tried to get her to show us what was wrong, to show us what she wanted, but she was becoming not just dysregulated, but also hitting herself and hitting other children. And it was very clear that something was wrong. And as the consultant for that school, I happened to have been there at that day. And so they brought her to me because they needed to continue to regulate the other children. And I just decided that what I needed to do perhaps was put her into a bathtub and calm her down with some water and do that. And as I took off her stockings, I found that there was a nail stuck in her foot. And she didn't try to take the nail out and she didn't try to do anything. But this was a situation where someone could have thought what we need to do is restrain her. And she was trying to tell us that she was in pain and she didn't know what to do about it. So, as a result of being very involved in self-harm, we're writing a paper about that right now, but being very involved in self-harm and other kinds of harmful, challenging behaviors, I was asked by the Israeli Ministry of Welfare, by court order, to provide a position policy paper on the subject of challenging behavior and restraints, which included a description or a definition of challenging behavior, a survey of international policies. We included Australia in that survey, and a presentation of recommendations, which I'd like to share with you now. And anyone who reads Hebrew, I will be very happy to give you that paper because it really was quite extensive. And there will be some policy change, I hope, as a result of that. So the first thing that we recommended is don't just say it's bad behavior or challenging behavior or absconding behavior, but try to understand the behavior, as we mentioned before. Prevention is always going to be better than crisis management. So for parents, in order to do some preventive work, you could do predictable routines, provide visual supports, include communication alternatives like augmentative and alternative communication. Try to observe the triggers when it's happening, with whom, and put in place safety planning already. For therapists, look for functional understanding, maintain co-regulation. You should be able to deal better with environmental modification, and really and truly, everyone needs a little bit more training in this area. Restraint is one of the most difficult topics because we need to provide safety for everyone. My view, as a result of looking into this more deeply than I ever thought I would, is that We need to be really careful that restraint never becomes routine, should never be punitive, or ever be a substitute for understanding the person and their behavior. There are some times when there is immediate danger. It is possible to consider restraint, but only as a last result and for the shortest possible duration. Our biggest contribution was to recommend and establishing a review board of professionals to evaluate each occurrence of restraint and analyze alternatives to provide recommendations for alternative behavior. We have to remember that our goal is to reduce the situations in which restraint is even an option. Safety begins way before the crisis erupts.
Thank you for that, Cory. I think many of the therapists, parents, and teachers would be struggling with students and adults as they get bigger in situations such as classrooms at homes where they've got to consider locking a door or creating a safe space, and some families even locking the food cupboard to manage. And I think those are often very difficult situations that are not put in place lightly, I think, by families and schools. And it does create a very difficult question for everybody. With living with and raising a child with autism, it really can be a roller coaster. And I always try and counsel parents to be kind to themselves and to their child or young person or adult child, and to make some time for the fun and the togetherness, and to celebrate the little wins, the small wins along the way. But it takes a toll on families, and we know that the rates of emotional and financial stress and the much higher rates of family breakdown compared to the general population is high. With your wonderful experience in the field of parenting and parental well-being, can you share some of your wisdoms with us tonight?
Thank you. I truly feel that I have learned so much about parenting from the parents that I have met and worked with over the years. So my experience has come from listening to the parents, and also from helping students understand the experience of raising an autistic child. Every year I have a research seminar, and it's called The Experience of Raising a Child, um, an autistic child or a child with other neurodevelopmental disorders. And the students ask questions, but most importantly, this so helps inform them when they're finished with their studies and go out into the field to figure out what they can do. One of my doctoral students who finished about 10 years ago now was very interested in this, and we looked for some kind of way to actually quantify interactions, dyadic interactions, and interactions with parents, and found something called the emotional availability scale, which is basically something for playing with your child or talking to your child as they get older. And there is a way of videotaping it and then scoring it. So we have done at this point a great deal of looking at the complexity of parenting from all different ways, and I'll try and share some of those results. But first, I just need to say that parents of autistic children carry lots of different jobs, two of which are parenting their autistic children, parenting their non-autistic children, but also case management. What do we do with all of the things that we need to do in terms of doctors and appointments and therapists and the many, many things that end up being put on these parents. And so, as you said, Natalie, families experience stress, financial strain, advocacy fatigue, relationship stress, and even very concrete things like sleep deprivation. And in the long run, kind of uncertainty about the future. A mother once described her journey with her daughter as driving behind a semi trailer truck up a hill. She said it has to be up a hill because it's really hard. And you really want to kind of pass that truck because it's going really slowly and you don't really know. But every time you think that you're on a clear road, you try to pull out and boom, something comes straight at you from above. So I really, really appreciate that uncertainty is really difficult, and everybody has a different tolerance for uncertainty. So the reality of parenting autistic children is really one of managing extraordinary demands, partially because you don't really know what to expect. Their children's progress may not be linear. One of the hardest things for any parent is that autistic development does not follow a straight line. Make progress, plateau, struggle again with something we thought we dealt with. And so the question becomes, how does one cope with that uncertainty? So as you said, one way is to celebrate the small wins. Don't get so bogged down or feel so trapped that you forget to notice the little things. Your child eating a new food, sharing a joke, having a successful play date, making things easier in your daily routines, expressing a choice or a preference. I understand that parents oftentimes feel that they need to be endlessly resilient, but they need support too. It's important to develop and preserve supportive relationships and networks, maybe with other parents with autistic children. There should be there should be a sharing of the caregiving, and really and truly learn how to accept help, but the right help for you. I'll just say that children do not need perfect parents. They need parents who feel supported enough in order to stay emotionally available. What we did in our emotional availability research was we compared the emotional availability of parents to teachers. We compared between boys and girls. We compared between playful interactions and more directed interactions. And basically what we found was that it didn't matter around what the parents and the children were interacting, but what did matter was the availability of the parent to support the child and the responsiveness of the children to the parent's availability.
Yeah, absolutely. And that importance of networks, but also forming your team around your child, your speech therapist and your educator and your pediatrician and your psychologist, forming that team is so important and can take time. A lot of the things that families struggle with in Australia is that good therapists don't always stay. They go on leave, or they move, or they have babies, and then they've got to look for somebody new and form that new attachment. But finding that right team around their child can sometimes be challenging as well. Is that the similar situation in Israel, or do you have centers where that team is sort of set up and it's already a multidisciplinary approach to intervention?
It's really a dimensional, multi-professional, multidisciplinary approach.
Yeah.
But many of the people, particularly who work in the public sphere, in schools or in clinics or in developmental therapies, are actually young people who are at the beginning of their professional journey. And as a result of which, there are people who leave. One of the things we found, and I think you're also talking about it, is that the second that there is a team, even if one person leaves, if the team remains the same and shares with who's ever coming in their information and are there to also support the parents and the child, there is a continuity of care that we think is just really important. So I will respond to you by saying, yes, we experience it. And yes, it can be a problem. And one of the ways that we have seen as helpful for dealing with that is basically the idea that a child should not just be seen by one person. And if those people work together as a team, the team can remain in place. And that is a helpful support for both the children and their families.
Yeah, thank you for that. It's difficult with limited time and resources. Everyone does tend to always focus on the areas that need support and improvement. But the importance of identifying those strengths, we all like to go to bed having done something well and achieved during the day. Can you tell us how to identify them and how we can make the most of these attributes?
So important. If we're talking about profiles, patterns, and possibilities, well, possibilities is what we're looking for. We want to find out what it is because strengths matter. One of the ways I think about this, and I oftentimes realize how visual a learner I am. So the way I see this is that if we take a person, they're 100% of anything that we're looking at. So if we say that there's a 20% deficit and there's an 80% strengths, I'm just using that as an example. We could say 50 and 50 if you like. If we look at it like that, and I focus on the difficulties, if I focus on the deficits or I focus on the challenges, which is really important, but we know that those are challenging, and I spend all my time there, but it only actually rises about 10%. I'm then at 40% as opposed to 60%. Yeah. But if indeed what I do is I say, you know what? Let's look at this differently. And I have strengths here, 50% strengths. I am going to take something that the child already does well and I'm going to make it better. Well, then that child can be at 70% strengths and only 30% of challenges. So let's look at it this way. We have to, if we put too much of a focus on deficit, that can limit what we can do to help the autistic person accomplish, because we can accomplish things through our strengths. And the strengths, which you all know, can include attention to detail, memory, persistence, creativity, honesty, pattern recognition, and deep interests. And many, many more. I'm just saying that. So, although strengths are oftentimes seen as secondary, they really can be the engine for learning and for development and growth. We can use those strengths as emotional bridges or as motivators. I'll tell you a quick story. I always love to tell my stories. We had a young man, I'm going to call him Yossi, that is not his name, but Yossi was very interested in bus schedules. I met him for the first time when he was 12 years old, and he could tell me the bus schedule of any bus to any location in all of Israel. Now, Israel is small, but it's not so small, and there's a lot of buses, and this was before the trains and all of that. And it was amazing to watch. And I could always engage with him around his bus schedules. And it was really quite good. And his goal in life was to become an egged bus driver. His parents didn't really like that, but they really wanted him to. And when he turned 18, um, he wanted to do some kind of year of uh, community service instead of his um, army service. And so I talked to someone I know who worked at Egged, and I said, I have this guy who knows every single bus schedule. Can you help me think of some place where we could put him where he could be helpful? Not a bus driver. And the end analysis was that he sat in an office and he coordinated schedules. And when a bus wasn't going, he could do that. And that was 12 years ago. And he still works at Egged Bus Authority. So really, strengths are so important. They can shape identity. If children constantly hear about what they can't do, well, then they begin to define themselves by their deficits. Okay? Let's help them define themselves by what they're good at, what they're interested in, what they can do. Because strengths can translate into employment, into relationships, self-advocacy, and even give purpose to life. I have other stories, but I have to stop because we want to have time really for questions. So let me just think about the 4 questions that we addressed tonight. What I really think we're talking about is the heterogeneity of autism, the complexity of diagnosis, which leads us to understanding intervention, our need for safety, our supporting of parents and understanding the complexity of parenting through identification of strengths. These are all very central issues in autism, and they're not abstract. It is understanding the profiles and the patterns of each and every individual that will allow us to help them reach their potential. Our goal is not simply to help autistic people overcome their difficulties, but it's to understand them and help them build lives that reflect who they are. Thank you so much. Thank you.
And I just listening to you, I feel like you're describing a fantastic situation in Sydney, where we've got the Friendship Bakery, and that's an organization and a business where they're doing exactly what you said, and with people with neurodiversity, and they're creating relationships, learning new skills, making a contribution. They make the best burgers. So it just it's wonderful to hear that those are strengths and approaches that you endorse and obviously are helpful. We see it in our community all the time. Cory, when we met and we discussed, the attendants tonight had provided us with many questions, and that was so helpful. So thank you to everybody online for that, because it was your questions that helped us to arrange and structure the webinar tonight, so that in discussion we were answering as many of your questions as we possibly could. And I'm sorry if we didn't manage to cover all of them. I do see there's some questions have come in, and we do have we do have some time. So if that's all right, Cory, would you mind if I posed some of them to you? One of our attendants has asked a little bit more, if you could tell us about the early learning environment, the adjustment recommendations, and particularly for the little ones aged 3 to 5.
There is a lovely program that is coming out of Canada, where one of our researchers from the Autism Center at Hebrew University is collaborating. with Professor Jessica Bryan in Toronto, and it is called Social ABCs. And the Social ABCs program is a program for young children, oftentimes even before they get a diagnosis, but where there's clearly some kind of suspected autism or some just difficulties in communication and behavior. And the idea is that what it's a parent training program, which is very good for these young kids because it doesn't help with their just in school doing this, but because of difficulties with generalization, sometimes it's difficult to bring those home as well. And so what we want to do is have parents also understanding the complexity of communication and behavior and actually kind of picking out what is most important to work on. And this really is communication as part of the social ABCs. The program, there's lots of information online, and I would suggest that you look at it because it will give much more information than what I can provide for. I will say the following three things, and I think that with that we can move on to another question, unless you feel that you'd like more information. But the first thing is that particularly when we're talking about very young children going into an educational framework or some kind of therapeutic environment, we oftentimes will see a big jump because they have the support that they need and they do that. And I just think it's really important to take advantage of that jump and understand what's going on and be very clear about what works and what doesn't work. And that's an important kind of thing. The second thing is that with young children, it's very important for us to deal with play as the way in which they learn naturally. And although play may be difficult for our kids, it is the most natural environment. So ESDM, the early Start Denver model, and Jasper, joint attention, symbolic play, engagement, and regulation, and the social ABCs, which are three of the best known evidence-based interventions for young children, are all play-based interventions, and I think that's important. And my final comment is that this is the time where it's very important to have that team so that we can make decisions that are appropriate developmentally, appropriate for the family, and can help us understand what is most important for that particular child at that time.
Fantastic. That really leads very well into another great question here about segregated education versus inclusive education. If inclusive education is to work well, how do you ensure that every child's learning goals are met? And it is often a concern from parents of children who do not have additional support needs and the impact on their children. What are your thoughts?
Wow.
Good one.
I am warning you, Natalie, that when I finish, I'm going to say, and what are your thoughts? So just be prepared. I do think that, look, that's a really hard question because inclusion or exclusion is not the same everywhere. So we don't always know exactly what support they'll get in an inclusive community or what support they'll get in an segregated community. And I think that what we really need to look for is what are the supports that the child needs and where and how can he get those best. I would hope that they could get them in an inclusive society, an inclusive framework, because in an inclusive framework, they are also experiencing the world as it exists. But sometimes that's not good and it's not good enough. So My answer to that, or my perspective on that, I think is a better way to say it. My perspective on that would basically be what we need to do is actually support our services. And we need to make sure that when a student is placed in an inclusive environment, that inclusive environment, he or she is being placed there because that's the right environment, but that doesn't mean that there isn't a need also for support. So I think it's actually something that we need to do in terms of service building, and I think it's an understanding of that. That's number one. And my final comment before I turn it back over to you is that it's really important to remember that being in an inclusive environment does not necessarily mean being included. Very often, our children are next to or looking on, or even in an inclusive environment, they're excluded and segregated. So it's really important to pay attention to that. If you're looking for some research to understand it, I would say please read the Dean and Kasseri research from, that's a good idea, from 2000 and something. I will pass that on to the people at Australian Friends of Hebrew University, and they can pass it on to anyone who's interested. Who they basically went in and checked children's interactions during recess time in inclusive and segregated schools and found some very interesting things, including camouflaging behavior, where the kids would stand next to a group, but they really weren't in the group, but the teachers felt that they were part of the group. So it's very important for us to understand that inclusive and segregative are not just an option of the definition of the program.
Yeah, that's right. And it's also hard to, it seems that education departments want to try and fit everybody into one size, and one size doesn't fit all. There needs to be options. There need to be options, and there need to be choices available that parents can choose and students can choose where they feel they're going to thrive and learn better. So it's not a case of one size fits all, is it?
I would say that that is true in educating all of our children.
Yeah, true, exactly. There's an interesting one, a little bit different. You spoke about the sensory subtype and the sensory issues, which we know can have a very significant impact on one's life. And the participant is asking that she knows that brushing to desensitize sensory dysregulation hasn't been shown to be valid in research. I'm very pleased to see that statement. Are there any other evidence-based suggestions on how to decrease sensory overload instead? And also any evidence for changes in the spectrum of sensory profile within the individual within their lifetime? So if so, is it a matter of modifying the sensory inputs, or is it the biological change, or is there something else to suggest what might be happening?
What a wonderful question. And I am actually sure that there are other people who are much more involved in this and who may give better answers than what I'm going to say. So please take what I'm saying as an expression of the knowledge that I have available at this point. But I will say what I know and try very hard to respond to what I think is just a really good question, because sensory differences were included in the DSM-5 because it seems to be one of the outstanding expressions of autism that affect so much of our intervention needs and intervention programming. So I really do agree that those questions need answering. Some of them have not been done. And I will start in this way. One, unfortunately, and I say unfortunately, um, um, sensory issues and sensory interventions to express to deal with those issues do not always go through the same scientific um, process that others do. In other words, we really want to check out by looking at single case studies. We really want to look at group studies before and after. And the best, we really want to look at random controlled trial studies for this. And there are very few in terms of what goes on in the world of sensory issues and intervention that I can point to as having those things. On the other hand, I will say that if something works for your child and it is something that it has what we call best practices means it is based on those principles which have been shown to be helpful um, in addressing some of the challenges that our kids have, then I would say if it works, pay attention, make sure that there's responsible professionals involved with you, and there's really no reason not to do that. So, are there changes over time? The answer is yes, including in the typical population, not just in the neurotypical, not just in the neurodiverse. As the brain matures, and I am sure Natalie can respond to this better on a physiological level, but as the brain matures, we are better able to, one, regulate our sensory input. Two, even if we can't regulate it, to cognitively cope better than we've coped up till now. And three, and perhaps most importantly, they co-regulate ourselves. So I have someone, autistic woman who works at a university here in Israel, not mine, who is supports the use of technology in her department. And she actually knows that what she needs to do is for every hour that she works, she spends 2 minutes behind a locked door in her office, actually with sensory stimulating to keep herself, she's an understimulated, to keep herself at her best amount of concentration. So she has found a way to cope with it, despite the fact that it hasn't gone away. So those would be the 3 points that I would think about. I hope that's helpful. I'm not sure that it is. Natalie, do you have anything to add to that?
I think that's very true. It's the function again and how to look at it in a very functional way to assist that person to get on with what they have to do. And the occupational therapists are generally really good at looking at that in a very functional way and looking at strategies on how to approach it. But I don't know. We did do the Cochrane review many years ago about auditory integration training, and so it's just a good time to say that unfortunately those auditory integration training programs are also not evidence-based and not recommended, certainly not by Speech Pathology International or the medical world. But what we do know is that if you want to look good at listening, then practicing listening is a good thing. But the actual integration therapies, sound integration therapies, are not evidence-based. Unfortunately, I think we're coming to the end of our hour together, Cory. It's been absolutely wonderful talking to you, and I hope this is the beginning of a wonderful relationship between Australia and the University of Hebrew University and yourself. I think Danielle might want to come back online. There we go. I think you're muted, Danielle.
Thanks. Thank you both so much. Thank you, Professor Shulman and Professor Silove, for generously sharing your time, your expertise, and deep commitment to this important work. Your patients, families, and communities are incredibly fortunate to benefit from such knowledgeable, compassionate, and thoughtful experts. We are incredibly grateful for your insights this evening, and it is wonderful to see this webinar fostering meaningful connections and collaboration between experts here in Australia and at the Hebrew University in Jerusalem. And I've got no doubt that you'll continue your conversation beyond this webinar. To everyone who has joined us tonight, thank you for your interest, your thoughtful questions, and for being part of such an important and timely conversation. We look forward to welcome you to the next webinar in our Impact Exchange from Jerusalem to Australia series, which will take place in September, and explore the fascinating relationship between the Bible and archaeology and what it reveals about the ancient connection of the Jewish people to the land of Israel. Thank you again to everyone, and especially to Professor Shulman and Professor Silove. Good night.
And thank you for the opportunity. And yes, we will continue our collaboration. Thank you so much.
Thank you.
Thank you, everybody. Bye-bye.